So what we're gonna do today are some exercises to maintain and improve your range of motion and prevent tethering and scar tissue from forming after your glossectomy surgery. And all of the exercises I want you to do while watching your tongue in the mirror. We want to make sure that your brain is connecting with your new tongue in a way that you're able to control your movements. The first thing we're going to do is make sure that you can stick your tongue out and move it side to side in a way that has some nice excursion and mobilization of your tongue. And when you're doing that, I want you to think about pushing as far forward as possible and really trying to get as far of a reach with your tongue as you can. And make sure you're watching your tongue in the mirror, okay? So you're gonna stick all the way forward, good. And I'm gonna count 10. Nice, get it to midline. 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Now from neutral, what I want you to do is use your right side because that's your stronger side, right? So you're gonna use your right side to pull your tongue all the way to the right. Now, I want your tongue tip, if you can, to touch the right corner precisely. Good, watch it in the mirror, beautiful. Now let's hold it, okay? 10, 9, 8, 7, good, 2, 1. Move it back to the middle. Let's try it one more time. Back to the right. Good. And so then after you've done that for 10 seconds, we'll relax. And back to the middle. Beautiful. When you go home, I want you to do that 5 to 10 times, each time you're holding it for 10 seconds. So the next exercise, use that right side again to push your tongue over to the left. I want you to get your tongue tip to the left corner as far as you can. Really kind of deviate that tip. Good. And hold that. 10, 9, 8. Very nice. 7, 6, 5, 4, 3, 2, 1, and relax. Good. The last piece is your tongue tip elevation, which is very important for speech and for chewing. You're gonna lift your tongue tip so that it's elevated while your mouth is as wide as it can be. Open, lift the tongue tip. Good, make sure you're contacting and then hold that. 10, 9, 8, 7, 6, make sure you're maintaining contact. 5, 4, 3, 2, 1, relax. Next, the exercises that we're gonna do are for precision and precise mobility of your tongue. What I want from this is slow movements and precise contact. I'm going to touch the tooth that I want you to contact with your tongue. And then after you get good contact, I want you to rest your tongue at midline after. Go ahead and open. So let's go ahead and touch this tooth here. You can close if you need. Beautiful. Relax the tongue. Okay, you can keep that mouth opening. Now I'm going to have you touch this tooth. Good. Relax. Now this tooth. Good. Relax. This tooth. Good. Very nice. This tooth. Good. The key is to relax in between this tooth. Beautiful. Very nice. So when you go home, you can kind of target the back tooth, hit it with your tongue, relax. The next one, hit it with your tongue, relax, okay? All around. So all around the world, taps. The last exercise that we're gonna go through is for swallowing after glossectomy. Patients can do this whether their entire tongue was removed or part of their tongue or half. It's a very good exercise for the back of your throat. You're going to push your tongue as forward as you can, okay? Sometimes people will say, hold it between your teeth. You don't have to, but as long as it's as far forward as possible. And then what I'm gonna have you do is try to really swallow from this area. So you're gonna really trigger your swallow from the back of your throat. This is not a tongue exercise, it's a throat exercise. So you're gonna want that back of your throat to come forward to try to touch the tongue. So all we're doing is pulling the tongue forward so that we're making the back wall of the throat work harder, okay? Good? All right, let's do it. From here, yeah. Beautiful, so good, perfect, okay? Awesome.